So we're going to start talking about parenteral solutions now and some of the implications for numeracy and calculations that parenteral solutions pose to us. But what are parenteral solutions? So we're going to start talking now about parenteral solutions and some of the implications of them for calculations and numeracy. So what are parenteral solutions? Dictionary definition is there where it says basically it's the route of administration, anything that avoids the digestive tract, and you will come to understand the reasons why that's different from being given by mouth through the digestive tract, because the body deals with drugs differently in that way. What we're going to be specifically talking about: intravenous solutions. So these are the type of things that are put in into the cannula in the arm, and they are used because they have a fast onset of action and reasonably easy to predict the outcomes. They also make faster dosing possible, and it's more accurate. You know exactly how much is going in. If you have to allow for the fact that the body has to absorb drugs through the gut, then it may absorb drugs in different ways. So this allows us to be a bit more accurate in what we're giving. We've got our bag there, intravenous bag, and let's assume that in that bag there is an amount of drug. So there's a number of ways in which we can say how much is in there. We might say how many milligrams of drug are in there. That's one way we could express it. We could say there are how many milliliters of the drug are in there. To do that, we would need to, for it to be give us any meaning, we need to know what the concentration is. So if we said there were 100 mils of our drug, we'd need to know that the drug was 20 milligrams in 5 mils or something along those lines. We've talked before a little bit about milligram per kilogram, but what I want you to think is, if we had these two patients, would it make sense to give each of those the same dose? Hopefully you'll see it doesn't. And what using intravenous drugs does is gives us, as I say, a more accurate way of being able to predict dosing and give the correct dose to the patient. So these milligram per kilogram doses, you'll remember these from working with children, and that we need to know how many kilograms the patient is to enable us to give accurate dosing here. So intravenous drugs are easier to adjust than solid dosage forms. You've really just got to add stuff into the bag to make it a different amount of drug being given. However, the problems arise here not so much in numbers, it's more in logic. It's making sure that we are very clear about the units we're using. So we think about the way that dose to be given can be expressed. It might be the number of milligrams per minute or per hour, because remember, the intravenous drugs are given by usually by continuous infusion over a period of time. We might be talking about how much volume we're giving per minute or hour, and again this needs us to know what the concentration of drug is for it to be meaningful. But another way we can do this is to say how many drops per hour or minute are we going to be giving, for which we'd need to know what volume of a drop is and the amount of drug in that drop. So that's another way in which we can express it, but as I say, you need to be clear which one of these you're using. And when you're doing calculations, it's best to always use the same type of units. So either using weight or volume or drops. So make sure you do the calculations all in the same way. The idea is to keep it simple. Okay, so do a step-by-step conversion between the number of milligrams, number of mils, and number of drops, and always use the same units in a calculation. Okay, so what process do we use? And this is if we're going to be using the amount and the number of mils. So work out the total dose to be given. The next thing we need to do is to say, if that's the dose we're giving, how many mils do we need to give? And then how long will we deliver it over? And that should give us the number of mils per minute. Again, if you need a bit of time, just have a quick look at that. Pause it for a while just to make sure you're sure about each of those steps. If we work out how many drops we're giving, again, we work out what the total dose is. Then we need to know what the volume is needed. And then we need to know, well, for that volume, how many drops is that? That will give us how many drops are needed. We go back to how long is it going to be delivered over. So we need to know how long we have to administer the drug. Some drugs can be given more quickly than others. Sometimes drugs are too toxic to be given all in one go. Sometimes they need to be given for a long period of time. And once we know that, we know the number of drops per minute that we need to give. So these can combine, but as I say, it's always important when you're doing your calculations, it's important to know what you're going to be, what you're calculating, and make sure it's in the same units. Okay, so let's look at an example. So having worked out the dose per kilogram, it's decided that 20 mils of Adiphos solution and 10 mils of multivitamin infusion are added to 500 mils of glucose 5% solution. So our Adiphos and the multivitamin are our drugs here. And they are in the glucose 5% solution, and that's to enable there to be, that's like the solvent, if you like, that it's given in. And this will keep it isotonic as well. We'll talk about isotonicity later. Now what they need here is for the drug to be given over 4 hours. So the administration set is then calibrated to 20 drops per mil. And we need to know the number of drops per minute to be given if the patient is to be given the full 500 mils over the 4 hours. So our total volume is actually 530 mils, remember, because you've got 10 mils and 20 mils of the other drugs. That's 4 hours. 4 hours is, we need to work out how many minutes in 4 hours. That gives us 240 minutes. So if there are 20 drops per mil, if we've got 530 mils, then we have 10,600 drops. That's the 530 mils times 20 drops in each mil. So we've got 10,600 drops. We know how long the time is that we've got to give it over. So therefore we need to give the 10,600 drops in 240 minutes. That gives us 44.17 drops per minute. Obviously that doesn't make any sense. We can't work out 0.17 drops in a minute. So we'll round that down to 44 drops per minute. Hopefully that made some sort of sense, and you can see how we use drops and mils in the calculations. Oh.